Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Wilson disease. Introduction. Wilson disease is a rare inherited disorder that prevents the body from properly removing extra copper. Too much copper can poison the body. With Wilson disease, copper builds up in the liver. The extra copper is then released directly into the bloodstream. This can cause damage to vital organs. This program explains what Wilson disease is and what causes it. It also covers its diagnosis and treatment options. Wilson disease. Wilson disease prevents your body from getting rid of extra copper. You need a small amount of copper from food to stay healthy, but too much copper is poisonous. Wilson disease first affects the liver. The liver keeps you healthy by removing harmful substances like toxins from the blood. Normally, your liver releases extra copper into bile, a digestive fluid. With Wilson disease, copper builds up in your liver. This causes liver damage. After enough damage, the liver releases the copper directly into your bloodstream. As your blood moves the copper throughout your body, copper builds up in other organs, including your brain, kidneys, and eyes. Over time, high copper levels can cause life-threatening organ damage. About 1 in 40,000 people get Wilson disease. It equally affects men and women. Symptoms. Wilson disease usually progresses to the point of having symptoms between ages 5 and 35, but people younger or older can also develop the condition. Buildup of copper in the liver caused by Wilson disease may cause ongoing liver problems. Rarely, acute liver failure may happen. If this happens, symptoms will appear suddenly. Wilson disease may cause the following symptoms: a tendency to bruise easily, extreme tiredness, fluid buildup in the legs or abdomen, jaundice or yellowing of the skin and whites of the eyes, swelling of the liver or spleen. Buildup of copper in the central nervous system may result in neurological symptoms including behavioral changes, muscle stiffness, trouble swallowing or speech problems, muscle movements you can't control such as tremor. Wilson disease may also cause arthritis, problems with the blood including anemia, slower blood clotting, weak bones. The most unique symptom of Wilson disease is a rusty brown ring around the edge of the iris and in the rim of the cornea of both eyes. This symptom is known as Kayser-Fleischer rings. It happens when copper builds up in the eye. Wilson disease can cause serious complications, including kidney problems, ongoing neurological problems, liver cancer, scarring of the liver or liver failure. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Wilson disease happens when a person gets 2 abnormal copies of the ATP7B gene. Each parent must give their son or daughter 1 abnormal gene. This gene plays a role in the transport of copper from the liver to other parts of the body. Wilson disease carriers are people born with only 1 copy of the abnormal gene. They do not have symptoms of the disease. Diagnosis. Wilson disease can be difficult to diagnose. It is rare and its symptoms are similar to those of other conditions. Your healthcare provider will ask you about your medical history. He or she will also ask about your family's medical history. If you have blood relatives with Wilson disease, you are more likely to have the condition. Wilson disease is diagnosed through a physical exam and lab tests. During the exam, a healthcare provider will look for visible signs of Wilson disease. A special light called a slit lamp is used to look for Kayser-Fleischer rings in the eyes. People who have signs of neurological damage from Wilson disease usually have the rings, but only half of those with only liver damage have the rings. Other tests and procedures used to diagnose Wilson disease include blood and urine tests, a liver biopsy to see if there is too much copper in the liver, genetic testing, which is a type of blood test used to examine DNA. Treatment. Medications to treat Wilson's disease must be taken for the patient's entire life. There is no cure. Treatment aims at lowering the amount of copper in the body. It also helps to keep copper from building up again. At first, the main goal of treatment is to get rid of extra copper. The healthcare provider must also teach the patient to avoid foods with copper in them to prevent further problems. Any damage to the liver, brain, or spinal cord is also treated. Certain drugs may be used to release copper from organs into the bloodstream. This allows the kidneys to then filter out the extra copper from the blood and release it in the urine. But these drugs may worsen neurological symptoms. Zinc may be used to block copper absorption from food in the digestive tract. Zinc may be safe to use at full dosage during pregnancy. Your healthcare provider can help decide what amount is best for you. Once the level of copper in the body is reduced to a safe amount, your healthcare provider will start maintenance therapy. Maintenance therapy often includes taking zinc and low doses of a medicine that releases copper into the bloodstream. Your healthcare provider will perform regular blood and urine tests to ensure copper stays within a safe range. It is also important to reduce your dietary copper intake by avoiding foods with a high level of copper, such as shellfish and liver. Your healthcare provider may tell you to avoid other foods as well. It is important to have your drinking water tested regularly for copper. Avoid taking multivitamins with copper in them.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Wilson disease is a rare inherited disorder that prevents your body from getting rid of extra copper. Too much copper can poison the body. Wilson disease first attacks the liver, the central nervous system, or both. Wilson disease may cause the following symptoms: a tendency to bruise easily, extreme tiredness, fluid buildup in the legs or abdomen, jaundice or yellowing of the skin and whites of the eyes, Kayser-Fleischer rings, neurologic symptoms, swelling of the liver or spleen. Wilson disease happens when a person gets 2 abnormal copies of the ATP7B gene. Each parent must give their son or daughter 1 abnormal gene. This gene plays a role in the transport of copper from the liver to other parts of the body. Wilson disease is diagnosed through a physical examination and laboratory tests. During the physical examination, a healthcare provider will look for visible signs of Wilson disease. Medications to treat Wilson's disease must be taken for the patient's entire life. Most people with Wilson disease can enjoy good health with early and effective treatment. Thank you for using Explain.